around the person who's suffering from this disorder. A lot of issues with regard to anxiety-provoking condition, a lot of stress-related situations that are happening either in the parents of the person who is, if we are dealing with an adolescent or a young child, or around the situation with the family, either the father side or the mother side, the problems related to the family, which again by itself, if we look more analytically to that, there is a precondition of obsessive compulsive and obsessive type of inclination in the patient father side or mother side, and then the whole family are basically going through that kind of phase and very tense and stress related, which then transfers that to the patient, and then the patient exhibits with problems related with hair pulling. Now the treatment modalities basically are psychotherapy and medication management. Psychotherapy basically to understand, to express, to achieve ability to know the person and to calm the person, to help the person who is suffering from this kind of situation to deal with the environment and accept him or herself the way they are, and then to reduce the stress and the pressure that they have, in order to then reduce the trichotillomania or hair pulling. The other aspect of biological intervention is mostly using medication. Medication based on some anti-anxiety medication could be used, but mostly the approved or the way that the mechanism of the action of the obsessive preoccupation and the serotonin theory based on using serotonin inhibitors, antidepressants with somehow higher doses to deal with the expression of this disorder, and to decrease the tension, which actually the serotonin reuptake inhibitors, if I said serotonin inhibitors, I meant serotonin reuptake inhibitor medication to deal with that condition, which is mostly of the antidepressants that are being used at present time, which is under care of a physician and to be evaluated after evaluation of the patient overall. Now, again, the most important thing that I would like to emphasize here is that the problem solving in psychiatry and finding a disorder is not just one-shot deal of looking at a person and saying you suffer from trichotillomania, then you get the medication. It's a much more complex issue related to the person who's suffering from a disorder and their relationship to their family, because we are coming from our family. So if we have a disorder and we have a tendency and we have a precondition, then it's very it's probably, and it's very possible to look at our background and see that, you know, our father side, our mother side, but they have all that susceptibility to the same condition that we somehow are expressing and exhibiting. Therefore, that's very important to have in mind. So it's not just like a strep throat and looking and saying, okay, we see the bug and then we give antibiotic and that's it. Every person has a certain way of expressing themselves due to their background and how they are coming to get to the point they are. So it's extremely important to look at the whole big picture. Again, thank you very much for your attention. Any questions, please you can comment or ask or call, and I'll talk to you soon.